Hey guys, welcome to GrowMed. Hope you all are doing well. So this is a video of the important topics from the pathology subject which were asked in the Fmge. तो as we all know that the pathology is a very vast subject. बहुत सारे questions है, बहुत सारे systems है pathology में जैसे कि CVS, फिर rheumatology, GIT, तो सारी system से related हर एक disease के बारे में you need to know all the points. तो एग्जाम के टाइम पे जब एंड मोमेंट पे यू कैन नॉट रिवाइज द होल सब्जेक्ट, हर एक पॉइंट सब कुछ रिवाइज नहीं कर सकते. सो दिस इज अ लिस्ट ऑफ द इम्पॉर्टेंट टॉपिक्स जिसको आपको रिवाइज करके जाना है एफएमजी के लिए. सो लेट्स स्टार्ट. पहले तो क्वेश्चन पूछे जाते हैं नेक्रोसिस से और उसके टाइप से रिलेटेड. So these are the type of the necrosis: coagulative, liquefactive, caseous, fibrinoid and the fat necrosis. So you need to remember the things like किस organ में ये देखने को मिलता है. Like the coagulative necrosis seen mostly in the solid organs and liquefactive necrosis seen in the CNS. जब भी CNS की इंजरी होती है तो cerebellum या फिर ब्रेन के कोई भी पार्ट की इंजरी होती है तब हमें लिक्विफैक्टिव नेक्रोसिस देखने को मिलता है. ठीक है. और केशियस नेक्रोसिस एसोसिएटेड विद द टीबी and fibrinoid necrosis, it is due to the immune complexes, मतलब कि जो एंटीबॉडीज बनती है उसके वजह से. एंड फैट नेक्रोसिस सीन इन द फैटी टिश्यू लाइक द ब्रेस्ट, पेनक्रियाज, ओमेंटम. सो अलॉन्ग विद दीज फीचर्स यू नीड टू रिमेंबर द इमेजेस ऑल्सो, क्योंकि इमेज बेस्ड क्वेश्चंस भी इससे रिलेटेड पूछा गया है. Apoptosis. तो apoptosis is programmed cell death. So you need to look at the pathway. जैसे कि ये कैस्पेसिस इन्वॉल्व होती है इसमें एंड देयर इज एक्सट्रिंसिक एंड इंट्रिंसिक इन्वॉल्विंग ऑफ द कैस्पेसिस 8 एंड द 9. तो क्वेश्चंस पूछे गए हैं इसके apoptotic genes को लेके, जैसे कि द p53 gene, द BAX gene and the PAC gene. These are the pro-apoptotic genes and questions are asked on the anti-apoptotic genes. ठीक है. तो एंटी वाले हैं BCL1, MCL1. And on to the necrosis. नेक्रोसिस को हमने ऑलरेडी यहाँ पर डिस्कस कर लिया था, इसके टाइप्स वगैरह. ठीक है. तो अब इन्फ्लेमेशन यूजुअली दो टाइप की होती है, अक्यूट एंड क्रॉनिक. Questions are asked on the changes. What changes in the scene when there is inflammation, the vascular changes and the cellular change. ठीक है. और एक बहुत ही फेमस वन लाइनर जो पूछा गया है ना वैस्कुलर से, दैट इज द हॉलमार्क ऑफ द acute injury and it is the increase in the permeability. Increase in the permeability is the hallmark and the first change is the vasodilation. If it will ask one liner. And the cellular changes like the margination, the rolling, the adhesion. ठीक है. एंड क्वेश्चन आर आस्क्ड कि ये मूवमेंट जो है किस प्रोटीन की वजह से होता है, जैसे एंड रोलिंग डन बाय द सेलेक्टिंग एंड एडहेशन डन बाय द इंटीग्रिन. ठीक है. सो क्वेश्चंस आर रिपीटेडली आस्क्ड ऑन दिस टॉपिक, इन्फ्लेमेशन, फाइन लाइनर्स. ठीक है. Then the CD markers for various cells in the body, there are various CD markers and you need to remember all those CD markers. Like for apoptosis it is CD95, for the T cell it is CD8 and the CD4, and for the antigen presenting cell the CD80, 86. For the B cell it is CD9, for the natural killer cell CD16, CD56. तो ये नंबर्स आपको याद करने पड़ेंगे कि ये किस सेल के लिए मार्कर है. So moving on, complement system. तो complement system जो है it is of three types: the classical, the alternate and the lecithin. So you need to know the whole pathway. और अगर whole pathway आपसे याद नहीं हो पा रहा है then no problem. You need to remember the main points, the basic point. Like, so in the classical pathway it is activated due to the antigen antibody formation and the immunoglobulin IgM is mainly involved in this, and the next is the IgG which should be involved. In the alternate pathway it is due to the activation of the IgA, immunoglobulin A, and the lecithin pathway due to the activation of the manual binding protein. ठीक है. And after all these proteins are activated, in the end they all form only one complex, that is the membrane attack complex. And the questions are asked कि ये membrane attack complex की जो वैल्यू है ये क्या है. तो ये है C5b से C5-9 तक. This is the membrane attack complex, complement number of the membrane attack complex. So moving on to the granulomas. तो granulomas से related questions आते हैं कि a disease दे देंगे and they will ask you to identify the granuloma, or image based questions are asked. Like the stem late granuloma, it is seen in the cat scratch disease. Seen in the cat scratch disease, and questions are usually asked of the positive agent of the cat scratch. ठीक है. फिर डोनट दिखता है Q fever में, डोनट granuloma seen in the Q fever, and a very important point is the TB. TB में Langhans chain cell granuloma दिखता है. तो ये usually granuloma है क्या? This is a positive organism. ठीक है, उसके surrounding में there are macrophages and lymphocytes, making it a granuloma kind of a thing. ठीक है. Then moving on to the germ cells. In certain diseases we can see the germ cells, like in the TB we can see the Langhans cells. And in the Hodgkin lymphoma we can see the Reed-Steinberg cell, and in the measles we can see the Warthin in Kilday cell. ठीक है, तो ये एग्जाम्पल से थोड़े से जेन सेल के जो एग्जाम में पूछे गए हैं इन द पास्ट ईयर्स. सो मूविंग ऑन टू द नेक्स्ट इंपॉर्टेंट टॉपिक, द इम्यूनिटी. तो इम्यूनिटी दो टाइप की होती है, इनेट एंड एडेप्टिव इम्यूनिटी, जो कि एक्वायर्ड है. ठीक है, तो क्वेश्चन पूछे गए हैं कि विच आर द कंपोनेंट्स ऑफ द इनेट इम्यूनिटी. इसके कंपोनेंट्स है नेचुरल किलर सेल्स, देन WBCs, देन कॉम्प्लीमेंट प्रोटीन्स, फिर बैरियर जो है स्किन एंड सिक्रीशंस. एंड द क्वेश्चन आर आस्क्ड कि नेचुरल किलर सेल्स किस किस कंडीशंस में इंक्रीज होते हैं. इंक्रीज इन द वायरल कंडीशन and in the acute condition. Okay, and adaptive immunity, it is mostly due to the B cells, T cells and the plasma cells, which are the immunoglobulins. ठीक है, so you need to also know the immunoglobulins, which are G, A, N, D and E, and you need to remember कि किस body part में ज़्यादा दिखते हैं, and which is increased in the acute condition and which is increased in the chronic condition. ठीक है, then moving on to the another very important topic, that is the graft types. I will give it a 5-star question. Graft types, host versus graft reaction, and this hypersensitivity. All these are very important topic, and one question compulsory. One question is a must. So there's no way कि आप ये topic नहीं पढ़ते जाएंगे. ठीक है, if you didn't go this topic, I assure you that 2 or 3 marks are yours. ठीक है, let's see what kind of questions are asked from this. The questions are asked on the graft types. तो graft के types है ऑटो, एलो, आइसो एंड xenograft. ठीक है, ऑटो मतलब कि सेल्फ, ओलो मीन्स डिफरेंट, दूसरे इंसान से लेके हम ट्रांसप्लांट कर रहे हैं. ठीक है, एंड आइसो मीन्स फ्रॉम द आइडेंटिकल ट्विन एंड xeno मीन्स फ्रॉम द एनिमल्स. ठीक है, तो यूजुअली वन लाइनर्स भी पूछे गए हैं एंड क्लिनिकल केस क्वेश्चंस भी पूछे गए हैं. लाइक विल बी गिविंग अ क्लिनिकल केस, अ पर्सन विथ बर्न्स, ही वाज एडमिटेड टू द हॉस्पिटल एंड उसके ट्विन ब्रदर ने उसको स्किन जो है ट्रांसप्लांट किया, तो व्हाट काइंड ऑफ ग्राफ्ट इट इज. देन होस्ट वर्सेस ग्राफ्ट रिजेक्शन. तो ये भी 3 टाइप के, 3 हाइपर अक्यूट, अक्यूट एंड क्रॉनिक. तो यू नीड टू रिमेंबर कि हाइपर अक्यूट हम बोलते हैं इफ द रिएक्शन अकर्स विद इन मिनट्स टू आवर्स. ठीक है, इन अक्यूट इट अकर्स इन मंथ्स, वीक से मंथ्स तक होता है, एंड क्रॉनिक मीन्स आफ्टर मोर देन 6 months. ऑल्सो क्वेश्चन आर आस्क्ड कि किस टाइप की रिएक्शन, हाइपर सेंसिटिविटी रिएक्शन. द हाइपर अक्यूट इज टाइप 2, acute can be type 2 or can be type 4, and chronic is type 4. ठीक है, अब ये रिएक्शंस होती किस वजह से है. सो द हाइपर अक्यूट इट इज़ ड्यू टू द प्रीफॉर्म्ड एंटीबॉडीज. प्रीफॉर्म्ड एंटीबॉडीज जो है वो ट्रांसप्लांटेड टिश्यू पे अटैक करेंगे. ठीक है, देन अक्यूट मीन्स इट इज़ ड्यू टू द ह्यूमरल टी सेल्स और द ह्यूमरल एंटीबॉडीज, सेलुलर टी सेल्स और द ह्यूमरल एंटीबॉडीज, द प्रीफॉर्म्ड एंटीबॉडीज. ठीक है, और जो क्रॉनिक होती है ना, इट इज़ ड्यू टू द टी सेल. ठीक है, so these were certain points which you must read from the host versus graft reaction. ठीक है, then moving on to the hypersensitivity reactions, questions are asked on the types as well as the examples. तो उनको पता है कि there are 4 types of the hypersensitivity reaction, so you need to remember कि किस टाइप का कौन सी डिसीज आती है. लाइक मैं एग्जाम्पल बता देती हूँ 1-2 कि टाइप 1 में आती है अस्थमा, एलर्जिक डिसऑर्डर्स. ठीक है, देन IgE से रिलेटेड एनाफिलैक्सिस. ठीक है, देन ड्रग रिएक्शंस. और टाइप 2 में आती है डिसीजेस विच आर एंटीबॉडी मीडिएटेड, लाइक द माइस्थीनिया ग्रेविस, द ब्लड ट्रांसफ्यूजन, RH इनकम्पैटिबिलिटी, ग्रेव्स डिसीज. ठीक है, ये थोड़े से एग्जाम्पल्स थे, यू नीड टू रिमेंबर ऑल ऑफ दोज. ठीक है, तो ये थोड़े से पॉइंट्स थे फ्रॉम द इम्यूनिटी, फ्रॉम द हाइपरसेंसिटिविटी रिएक्शंस विच यू मस्ट रिमेंबर. सो मूविंग ऑन टू द नेक्स्ट टॉपिक, दैट इज द स्टेन्स और द पिगमेंट्स. Various stains are used to identify certain electrolytes, जैसे कि Prussian blue is used for the iron, hemosidrin. ठीक है, और मेलानिन के लिए हम यूज़ करते हैं मेसन एंड फेंटोना. So these are certain examples of the stains, and you need to know कि ये stains किस चीज़ को हाईलाइट करने के लिए यूज़ हो रहे हैं. जैसे कि लाइपोफ्यूजन, इट इज़ अ येलो ब्राउन पिगमेंट. ठीक है, देन द Prussian blue, it is used to identify the iron for the hemosidrin, and one cosa it is used to identify the calcium. Likewise, the chondrocyte for the amyloidosis, then mesonophontona for the melanin, and likewise there are certain other stains like the oil red, Sudan black, which are used for the lipid. ठीक है, so you need to remember all these stains and for what purpose they are used. And moving on to another very important topic, the vasculitis. So vasculitis usually it is inflammation of the blood vessels, ठीक है, and it is classified into the large, medium and small vasculitis. You need to remember which diseases are the large, which are the medium and which are the small. Like the large, it is due to the Takayasu arthritis, also called as a temporal arthritis, genital arthritis, ठीक है. Then the medium, it is due to the Kawasaki or the Burgess disease, and the small, it is due to the venous granulomatosis, ठीक है. You need to remember the histopathological classification, histopathological findings of each of these vasculitis. Then moving on to the arteriosclerosis. तो arteriosclerosis is of two types, the hyaline and the hypoplastic, ठीक है. तो hyaline हमको देखने को benign hypertension में और hypoplastic देखने को मिलता है malignant hypertension में, asked as a one-liner in the previous list, ठीक है. और clinical case भी पूछे गए हैं इससे related. In the hypoplastic, you can see the onion skimming of the blood vessel. Then moving on to the lung disorders. The lung disorders are broadly classified into the obstructive and the restrictive. ठीक है, obstructive में आ जाती है examples like the emphysema, chronic bronchitis, asthma and the bronchitis. So you need to remember the pathological findings of this. Like in asthma, you can see the three C's: Charcot-Leyden, crystal, areola bodies and Cushman spiral. And in the emphysema, there will be acinar, pan-acinar and the central acinar. You need to also know the causes, ठीक है. जैसे कि अल्फा एंटी-1 ट्रिप्सिन डेफिशिएंसी हो गई, then we can see pan-acinar emphysema and smoking वाले person है central acinar. So अगर clinical case पूछे जाएंगे ना, तो describe the features like the alpha anti-1 trypsin was deficient in the patient, तो किस टाइप की emphysema होगी patient को. Then the restrictive lung diseases. Restrictive lung diseases are mostly due to pneumoconiosis, जैसे कि silicosis, anthracosis, asbestosis, ठीक है. So you need to remember all the histopathological findings on the silicosis, anthracosis, and along with that the X-ray findings. And which kind of occupation causes this disease. जैसे कि अगर factory work दिया गया है, cement industry, stone cutting, then it will be the silicosis. And if it is coal, then it will be the anthracosis. And if the patient is working in the cotton industry, then it will be byssinosis. So these are certain examples of the pneumoconiosis. ये pneumoconiosis भी बहुत ज़्यादा important है because questions are asked from in relation with the PSN also. Then moving on pneumoconiosis, which we have already discussed here now, ठीक है. Then sarcoidosis. It is an autoimmune disorder. And there is involvement of the lymph nodes, bilateral thyroid lymphadenopathy, and on chest X-ray you can see the calcification. Okay, higher calcification, then it is suggestive of the sarcoidosis. Then moving on to the Buerger's disease. Buerger's disease is also a very important disease, important topic, as in integration with the surgery. Usually image-based questions देते हैं Buerger's disease पे. In this the distal fingers are involved and there will be blackening क्योंकि blood supply वहाँ पर पहुँच नहीं रही है. Then the next, endocarditis, also a very important topic. So endocarditis, we know that there are the rheumatic heart disease which cause the carditis, then infective endocarditis, Liebman sac endocarditis and non-bacterial. ठीक है, तो questions are asked कि wall के किस part पे these are involved. Like in the rheumatic heart disease, it is involved in the tips of the wall. ठीक है, and if it is LSE, that is Liebman sac endocarditis, then it will involve both the sides. The vegetations are present on both the sides. And if it is infective endocarditis, these are large and bulky. Okay, so these are certain points about the endocarditis which you must remember. Then moving on to the anemia. So questions are asked describing a clinical case kind of a thing and asked you to make the diagnosis of the anemia, और पूछे जाते हैं कि किस टाइप की अनीमिया किस डिसीज़ में देखने को मिलती है. सो यू नीड टू लुक फॉर ऑल द डिसीजेस. सो आई गिव 1 to 3 एग्जांपल्स. ठीक है, जैसे कि माइक्रोसाइटिक जो है आयरन डेफिशिएंसी अनीमिया में देखने को मिलता है. एंड माइक्रोसाइटिक मीन्स द सेल्स आर स्मॉल एंड सीन इन द अनीमिया ऑफ द क्रॉनिक डिसीज बीटा थैलेसीमिया. ठीक है, देन लेड पॉइजनिंग साइटोप्लास्टिक अनीमिया. एंड माइक्रोसाइटिक क्लासिकली सीन इन द मेगालोब्लास्टिक अनीमिया, आस्क्ड रिपीटेडली मैनी टाइम्स. The megaloblastic anemia क्यों होता है? Because of deficiency of the vitamin B12 and the folic acid, that is the vitamin 9 deficiency. ठीक है, फिर इसके साथ साथ अगर लिवर डिसीज़ भी है ना, chronic liver disease, उसमें भी मैक्रोसाइटिक अनीमिया देखने को मिलता है. एंड द नॉर्मोसाइटिक अनीमिया सीन इन द किडनी डिसीजेस, ठीक है, माइलोफाइब्रोसिस में देखने को मिलता है, मल्टीपल माइलोमा में, एंड मेटास्टासिस. सो दीज आर सर्टेन एग्जांपल्स ऑफ द अनीमिया. क्वेश्चंस आर आस्किंग माइक्रोसाइटिक हाइपोक्रोमिक अनीमिया किसमें देखने को मिलता है, एंड या फिर मैक्रोसाइटिक केस दे देंगे कि पेशेंट हैड अंडरगॉन टर्मिनल आईएम रिसेक्शन, तो किस टाइप की डेफिशिएंसी होगी या फिर किस टाइप की अनीमिया पेशेंट में देखने को मिलेगा. Then moving on to the peripheral blood smears, RBCs in the peripheral blood smears. So in certain disorders, we can see certain different shape, size of the RBCs. Like in thalassemia, we can see the target cells. तो usually image based questions पूछे गए हैं इस पे, so you need to remember the images as well. जैसे कि इकाइनोसाइट, दिस इज सीन इन ए बीटा लाइपोप्रोटीनीमिया, ठीक है. फ्रैगमेंटेड या फिर शिस्टोसाइट सीन इन द microcytic and geopathic hemolytic anemia. And there are certain inclusions seen in the RBC like the Howell-Jolly bodies and the basophilic stripling, which is seen in the lead poisoning, then Heinz bodies, which is due to the denaturation of the hemoglobin, and the siderotic granules, Pappenheimer bodies, ठीक है. So see the certain inclusions which you need to remember along with the images. And questions are also asked on the types of the anemia, like iron deficiency anemia, the markers, and the most important marker is the serum ferritin, and the parameters which are decreased, which are changed in the anemia. Then moving on to WBC tumors, ठीक है. White blood cell tumors, mostly called as the leukemia, and this is the broad classification of them, classified into the acute myeloid, acute lymphoid, chronic myeloid, chronic lymphoid, Hodgkin and non-Hodgkin lymphoma. And Hodgkin and non-Hodgkin lymphoma, there is certain various subtypes also. Okay, so you need to remember the clinical features, like there will be splenomegaly, hepatomegaly, and there will be anemia in the patient. There will be fatigue and the recurrent infections. Okay, so these are certain common findings seen with all the kind of the tumors. And these tumors are associated with certain chromosomal abnormalities, like the AML. It is associated with translocation of the 1821, translocation of the 1517. So you need to know which type is associated with which type of translocation. And CML is associated with the translocation of the 1922 called as a Philadelphia chromosome. And in the Hodgkin lymphoma, we see the Steinberg cell, which is a classical finding, and you also need to remember the markers associated with it. And there are also subtypes of the Hodgkin lymphoma, like the lacunar variety, then the popcorn, then the lymphocyte predominant lymphocyte rich. So you need to read about all the subtypes. Then a classical question, a very famous question asked is from the non-Hodgkin lymphoma is the Burkitt lymphoma. So questions are asked on its translocation 1814, and on the biopsy it looks like a starry sky appearance. So you need to remember all the points regarding the WBC tumors, because it is also asked in integration with the medicine subject. Then for the multiple myeloma, it is a tumor of the plasma cells, and questions are also asked on the investigation of choice, which is the serum electrophoresis, and also questions are asked on the inclusions. You can see the intracytoplasmic inclusion, the Russell body, and intranuclear, the Dutcher body. And the cells which are affected, they are seen like this, a moth or a mulberry cell-like appearance. And along with that, you need to know the X-ray findings which are seen in the skull. Okay, so it is a very, very important topic, and every year one question from the multiple myeloma is asked. Then moving on to the amyloidosis. So questions are asked on the amyloid protein deposition, like if it is associated with the dialysis, then it will be amyloid beta 2 deposition, and if it is primary amyloidosis, then AL will be deposited. So you need to remember all the types of the proteins and the disorders in which they are found. So vacunators, these are the tubes in which we will collect the blood of the patient for the sampling. They are given various color codes like the red cap, the grey cap, based on what study you want to do on this patient. Then move on to the nephritis and the nephrotic syndrome, also a must-do topic, because questions are asked clinical cases or one-liners integrated with the medicine or the surgery. So nephritis, the most common type of the nephritis is the post-streptococcal glomerulonephritis seen in the children, and the nephrotic in the children minimal change disease, and in the adult it is membranous glomerulo-proliferative. You need to know the types and the histopathological examinations, along with that clinical features also. Then the chromosomal abnormalities, like the abnormalities seen in the Turner syndrome, it is due to the 45XO. Then the Down syndrome, it is the trisomy 21, the Edward and the Patau syndrome. And there are various diseases caused due to mutation or base pair substitution, like the sickle cell anemia. So you need to know all these chromosomal abnormalities. Then moving on to certain GI disorders like the Barrett esophagus, you need to know the clinical features and you need to know the histopathological examination findings, like there will be intestinal metaplasia seen in the esophagus. Then the celiac screw, you need to know the autoantibodies against it, the clinical features, and how do we treat the patient, all the findings related to the celiac screw. And moving on to the inflammatory bowel disease. So the inflammatory bowel disease, there are two types, ulcerative colitis and the Crohn's disease. So you need to know the clinical feature. So you need to remember the histopathological findings, along with that the X-ray findings, the clinical features. Okay. In Crohn's disease, there will be transmural involvement and there is skip lesions. And it will start, the most common location is the ileum, whereas in ulcerative colitis, it will be superficial and the rectum starts from the rectum and flows retrograde. Okay. So these were certain points which you need to remember. And the Whipple's disease, the positive organism of the Whipple's disease, it is the treponema. It is a malabsorption disorder, and the classical finding is there is the accumulation of the macrophages in the intestine. Okay. Then on the Peutz-Jeghers syndrome, image-based questions is asked. Okay. Or इसमें there will be multiple hematomas and mucocutaneous pigmentation is seen, and they are at a high risk of development of colon cancer. So these are certain important topics which you must read. Also, along with these questions are asked on the tumors, like the cardiac tumors, and histopathological findings of the cardiomyopathies, like the HOCM, dilated cardiomyopathies. And also questions are asked on the topic like the genital tumors, the seminoma tumors, teratoma, then dysgerminoma. There's a lot to read in the pathology, but in the end, we cannot complete each and everything. So this was a list of the certain points which you can revise before going to the exam. So the disorders related to the system, like the endocrine, the GIT, the respiratory, these will be covered in other subject also. So in this video, I have only covered the important topics which particularly belong to the pathology, which you must do from the pathology itself. Okay. So that's it in this video, guys. I hope you like the video. I hope you find it useful. Please like the video, subscribe to my channel, and also share it with your friends. Thank you.